I'm making this video because I got a request from Sima Vadva, one of my followers, and she says that she has a massive sweet tooth, but she's also concerned about her oral hygiene. So she wanted me to share some tips as to how she can have her sweets, but also take care of her oral hygiene. So that's a very good tip. Thanks for that request, Sima. I don't think there's any function that we have or any occasion, any party in the Indian subcontinent where we don't enjoy with sweets. And of course, why shouldn't we not enjoy our sweets? You should definitely eat them. And I'm also aware of the fact that a lot of dentists advise you guys not to have sweets. I practically think that that's impossible. You can still have your sweets and you can also look after your teeth very well. So if you are one of those people who want to learn more about how to maintain your oral hygiene, well, stick around because I'm going to share with you the tips and tricks that I use to look after my teeth. Are you aware of the fact that our sweets, mithais and the chocolates that we get from the supermarket are heavily laden with refined carbohydrates and simple sugars? These are a lethal combination and they're extremely destructive for our teeth. The reason being that these are the favorite food of the bacteria that are in our mouth. So these get eaten up and digested by the bacteria, and the bacteria produce acids as a byproduct. These acids start destroying the surface of the tooth and they initiate the process of cavitation or the formation of cavities in the teeth. So that's the reason why everybody says, dentists normally tell you guys to stop having sweets or to reduce the intake of your sweets. And of course, sweets are really bad for your health as well. So I think it's not a bad idea to give it a little bit of thought. Yep. Next, we are going to discuss as to how we can have our sweets and also look after our teeth in a very smart way. Okay, ladies and gentlemen, it's time for me to discuss the strategies that you can use to look after your oral hygiene. But first of all, I want you to evaluate your eating habits. How frequently are you eating or drinking throughout the day? Not water, but other things. Any beverages that might be sweetened beverages, anything else, any foods which might have refined flour or refined carbs and sugars in them. How many times are you eating them throughout the day? Because the frequency matters a lot. It means the more frequently you are eating or snacking, the more food is being provided to the bacteria that is going to be producing more and more acid. More acid means more risk of your teeth developing cavities. So this habit needs to be corrected. Designate one time during the entire day just as your sweetie time, perhaps before your lunch time. So you have your sweetie before lunch, and after you've had lunch, that sweetness or that sweet, if it is stuck around anywhere, it gets washed out by the food that you eat after that. You can also use a toothpaste and a toothbrush, or you just brush your teeth immediately after having anything sweet. Remember to use a fluoridated toothpaste all the time because the fluoride gets absorbed by the teeth and it makes the teeth more resistant to dental decay. You can also use sugar-free chewing gums. Just pop one or two in your mouth, chew for about 15 to 20 minutes. This way, the mechanical chewing action secretes a lot of saliva in the mouth, which has a cleansing effect, and saliva also has bicarbonate ions in it that tend to neutralize the effect of the acids which are produced by the bacteria in the mouth. You can also rinse out your mouth a couple of times with normal tap water to dilute that sweetness from your mouth or dilute that effect of the sweet from the mouth. Couple of times a week, I think that you should be having your salads as well as replacing your sweetie with a seasonal fruit like mango, watermelon, peach, or whatever you like to eat. You can also have salad because salads have a lot of roughage. They have water also, so they have a cleansing effect. A mechanically cleansing effect is initiated when you are eating salads. So that way your mouth gets more and more clean and it remains healthy as well. There's a very good product in the market which is known as Tooth Mousse. It is available online, and I haven't been sponsored to speak about it, but because I have used it and a lot of my patients have used it, it is phenomenal. So that's the reason why I am discussing about it. Now this product has been designed and manufactured by Australian scientists, and it has been derived from a milk protein. So if you are allergic to milk and milk products, or you are lactose intolerant, please don't use it. It has to be used at night, most preferably. Not that you can't use it during the day, but I prefer you use it at night, because at night there is no salivation, and the longer this product stays in contact with the teeth, the better will be the results, and you will get fast results as well. So during the day you can use it, but because we salivate and we keep eating something or the other, the effect wears off very quickly. So at night, just before you are going off to sleep and you've brushed your teeth, take a small amount of this product on your fingertip, smear it all along on all the surfaces of your teeth, and go off to sleep. Don't rinse out, don't spit it out, do not have anything to eat or drink. The idea is to just keep that in contact with the teeth for as long as you can. So while you're sleeping, it's going to be in contact with the teeth. So it's very, very good. Try it out and tell me how you feel about it. It comes in 6 different flavors, so you can choose your favorite flavor and use it. And if you tend to swallow it, that's okay. It's perfectly okay. It's not poisonous or toxic. And trust me, the flavors are so yummy, you feel like eating them. Okay, thank you so much for watching my video. But till my next video, don't forget to share, smile, and subscribe. If you have any questions, please mention them in the comments below. And if you want me to discuss any of the dental issues that you may be facing and want me to talk about them, I'm more than happy to do that. Thank you very much. Bye-bye.